Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
Does this mean we should all be wearing masks again?
Indoors, in any kind of crowded place, yes, you should be wearing masks. It is strongly recommended to do that, but there is no official mandate as of this time.
So talk about the difference in how a high level of COVID now compares to what we were looking at in January with the hospitalizations and death rate numbers.
Right. There's so much more immunity in the population right now compared to before. In other words, people who've been vaccinated, people who've been boosted, people who had COVID in the past, maybe had Omicron recently, all that comes into play. So high risk is defined. 200 cases, greater than 200 cases and greater than 10 hospitalizations per 100,000 people per week. It's a number that can be figured out, and we're there. Chicago is 290, Cook County is 367, and 15 out of 102 countries are high risk.
Now, people may perceive this mutation as not being serious compared to what we have been through, but you say that it can cause serious disease. Why is that?
Oh yeah, no. So what you're talking about, I think, is the BA2.12.2. That's the variant that accounts for 58% of the cases in the United States today. It is more transmissible than all the other Omicron variants, and it's got a little bit of Delta in there. So it's definitely not a milder disease at all. It could be a little bit worse.
We have been talking about monkeypox. It's in the news. I still think people are confused. Is this something that's a possible pandemic? Is this something that's deadly? Give people the nuts and bolts of it, would you?
Yeah, the nuts and bolts are clear. Just from last week and the week before, there was a lot of really high anxiety about it. And what's happened? I mean, there's I think just 150 cases outside of Africa right now, 9 only in the United States. It is not exploding. It's not going to be a pandemic. It's not even going to be an epidemic. It's going to be an outbreak. And it's relatively easy to control. There's 2 drugs that are approved to use it, and there's vaccines that already exist for it. And the government has ordered 34 million more of those vaccines, which will only necessarily be given to the healthcare workers and people who are contacts of those that are infected. So that's basically the state of the art at this particular point. Plus, none of the 150 have died.
What happens to you when you get this, beside the sores we're seeing?
Yeah, so typically you get like a flu-like illness, and then it breaks into this rash. It looks like chickenpox, but all the lesions are at the same level of development. That's very typical of smallpox, which has been eradicated. This is much milder. It lasts for 2 to 4 weeks, and in Africa, where this is a problem, West Africa, the mortality rate is 1%. In Central Africa, it's 10%. So somewhere between 1 and 10%. But the cases that have occurred so far outside of Africa, nobody has died.
All right, Dr. Murphy, thanks for joining us again.
Thanks, doctor.
Great. Good to see you.
Good to see you, too. Let's get a check.